Well, good afternoon. I'm Rich McKeon. Welcome to Bite-Sized Bits, the fast break of webinars, where we talk about value-based healthcare in a short, succinct way. We are appreciative of our co-hosts, the David Eccles School of Business at the University of Utah and the Green Templeton College at the University of Oxford. And appreciate, too, our contributing sponsors, the J.P. Morgan, Leavitt Partners, Intermountain Healthcare, and Select Health. We'd remind you of our symposium scheduled for May 11th and 13th titled The Global Value-Based Healthcare, a symposium, and we appreciate the opportunity we have today to talk to Governor Mike Leavitt. Governor Leavitt's the former governor of the state of Utah. He's the former administrator of the United States Environmental Protection Agency. He's also the former secretary of the U.S. Department of Health and Human Services, and the founder of Leavitt Partners, a firm focusing on value-based healthcare. So, Governor Leavitt, it's great to have you with us.
Oh, thank you, Rich. Pleasure to be with you.
So, we talk about the secret ingredient of value-based healthcare being public health. Define it. Talk about it in the broad context.
Well, of course, in the broad context, we're talking about measures that we take to improve the healthiness of the environment we're operating in. The public, all people at one time. It's a broad definition, but it can be everything from making certain we have clean water to assuring that a community that might have a preponderance to be overweight begins to be conscious of how we can do it. Immunization, for example, is a public health measure where we're treating everyone at the same time. It has been a field that has been relegated to almost a second-class citizenship over the course of the last 40 or 50 years, wrongly in my opinion, and we're paying a price for it, and it is truly the secret ingredient in value.
So you began this as a governor in public service, but I know that you were impacted at the Environmental Protection Agency as you began to define and value public health.
I have to confess that I was among many people who did not fully appreciate the role of public health in keeping Americans healthy. I served for 3 terms as governor. I dealt with public health, I understood parts of it, but I did not fully appreciate it until I became the administrator of the Environmental Protection Agency. When I went to Washington and began to understand the role of clean water, clean air, clean land, or being able to have land that is free of the kinds of dangers that it can be. When I started seeing Superfund sites around the country and seeing what neglect of the environment can do to the health of people, it occurred to me, this is not a regulatory agency, this is a public health agency. Then I began to understand the profound impact that it has had over time in the health of Americans. If you look at longevity over the course of the history of the United States, we took a profound jump in the 70s and 80s and 90s in lifespan. Well, that is right during the period when we started to focus on clean air. It's the exact period when we started to take care of cleaning the water. It's when we began to recognize that many of the things we were doing in mining and other areas were in fact impacting people's health. So I came to understand that the Environmental Protection Agency is essentially a public health entity because not only is there a reverence we have for the earth itself and for its importance in our lives, it's also a great determinant of our ability to have food that is free of adulteration or poisons. It's also the means by which we can protect respiratory systems on a mass basis. It's the way we can, in fact, prevent highly preventable waterborne diseases. So public health is a wide scope and one that we underappreciated for a long time.
So you use the word prevention. And I know at the EPA we began to value the shift that had occurred from cleanup to prevention in terms of the Environmental Protection Agency, and the 1990s being that period of new environmentalism where prevention became the watchword. How did that impact your view of public health?
Well, first, we probably ought to disclose to your viewers that when you talk about my service, we're also talking about your service, because you were Chief of Staff at the Environmental Protection Agency during the same period of time, and we worked together. And what we discovered, as you suggested, is that 30 years the EPA went through a period of cleaning up the sins of the past. And then it became clear that lots of that had been done, and we needed to turn our attention to the future. And it was not just about cleaning up the past, it was about preventing things in the future that could impact health. We have seen the same thing occurring in healthcare. We titled this little conversation about public health being the invisible ingredient in value. This is a great example of it. We at the EPA began to turn our attention to preventing things from happening that would impact health. In healthcare, we're now turning our attention away from just keeping people or helping people when they're sick to preventing them from becoming sick. We're starting to focus more and more on wellness. Now, there's a public health issue. We're in the midst of a pandemic disease. We're about deploying the tools of public health to prevent people from getting it. Yes, we have to care for them when they're sick, but we have all engaged in this remarkable human experience of having an entire society essentially locked down to prevent disease. Now, this is a very new era in health care, to move our attention not just to care, but also prevention. And it makes public health this invisible ingredient in the whole genre of healthcare, of value-based care.
So how do you see the application into value-based care in terms of how it drives value-based care?
Well, value-based care is about paying people differently for the care they provide. It's about giving them, rewarding providers of care for keeping people healthy, as opposed to just helping them recover after they're sick. Now that we're doing that, it's become clear to healthcare providers that they need to go upstream, because they can't make this work economically unless they're able to slow the number of people. And that's taking not just environmental factors into play, it's also taking dietary things into play. It's taking drugs and different social determinants, and hence the whole idea of social determinants of health. Broadly speaking, you could essentially say that our work at the Environmental Protection Agency was a social determinant of health. You might refer to it as an environmental determinant of health, but that line between environmental and social is pretty well undefined. They are clearly codependent on one another.
So one of the things that was always a concern for people early on with the EPA was the economics. It was going to cause an economic downturn. In fact, it did the opposite. How do you see that happening in healthcare? I mean, how is value-based healthcare good economically?
Well, let's just use the COVID pandemic that we're involved in. This great collision between whether or not we are preventing disease, public health, or whether we are building the economy, economic. What's become quite evident is that if you don't have health, you're not going to have a strong economy, and that an economic strength is based on health. And so these are very much co-determinant. And I think it is clear that you can't go to either extreme. You literally have to accomplish both. And it's the reason we're starting to see this conversation in healthcare begin to revolve around social determinants of health, because it's the way that we make the economic equation work is to reduce the demand on the healthcare system by increasing health. And we do that in a deploying public health tools. And hence, public health is the invisible ingredient in value-based care.
So do you then see the post-COVID world as or do you see that as COVID as an accelerant of this?
I think it has clearly been a reality that we're all learning through this experience. And one of the things I think we will have ingrained in our psyches now is the importance of health and its link to the economy. Now, this debate's going to go on because in any social setting where you have an entire population, people have different circumstances. I was involved with a conversation with one of my children who was talking about whether or not she should have her daughter enrolled at a dance studio. Well, she was worried because you couldn't social distance there. But the dance studio owner was entirely worried about whether or not the business was going to survive. In some way, those have to be reconciled, and at times they don't. But in the big picture, we clearly have to have both.
So the campaign that has occurred so far with regard to the primary season has had some emphasis and discussion about single-payer systems, universal health care. How do you see that discussion coming, first of all, in this election cycle, but beyond? How do you see that playing out?
Well, without getting into the question of who's going to win, we just have to acknowledge the fact that in pandemic periods, everything changes. That the economics get redefined, the politics get rejiggered, sociology changes, and all of that is happening right now. Part of that is we're beginning to see the gaps in how our society works and inequalities that it's creating. We're starting to see the inefficiencies in our healthcare system. And that's going to impact the way the country's been responding to the pandemic is going to impact the politics and the sociology. And I think it has clearly re-energized, or at least energized in a bigger way, this conversation of how do we deal with the inequities that exist in healthcare. And it will undoubtedly then begin to generate more conversation about whether or not the system that we have is working, or how can we improve it. Do I think we'll have a government-run, government-operated healthcare system in my lifetime? I doubt it. But I think we're going to see some changes. I think we'll see the government substantially more involved in payment. I think that we're likely to see expansion of government administered programs. I don't see us seeing the government running healthcare providing.
This is going to be an interesting election cycle because this discussion will begin to occur despite the fact that both parties seem to be, in terms of their official candidates, not in favor of a single-payer system, but it's part of the discussion. Where does it end up?
Well, I think things are setting up to where you could have a quite profound political shift. We see those from time to time, but they often come when there is a period of economic unsettlement. It often comes when there's a period of war or disaster and people evaluate the handling of the government. We're at a period where you've got essentially all of that happening. So the chances that we're going to see a political shift is pretty high. If in fact we do end up seeing a Democrat sweep, for example, very early on, there will be a conversation about the expansion of, for example, Medicare. Now, will there be a move to do Medicare for all? Yes. I don't think it will succeed. What about Medicare for more? Some version of that very easily could succeed. What about a public option? That undoubtedly will be on the table. And if you have a president and two chambers of Congress in the same party, it could happen. Doesn't mean it will, because minority parties have proven effective in being able to gum things up enough that big things sometimes that look evident don't happen. But it could.
So one of the things that has been a concern for systems globally is just sustainability generally in terms of the financial viability. Let's talk about that in the context of public health.
Well, look, I think the elephant in the room, if you will, is the deficit. In the course of the last 6 months, we have added somewhere in the neighborhood of $5 to $6 trillion to a debt that was already approaching $20 trillion. We're going through a period when the United States Treasury is receiving substantially fewer tax dollars and has dramatically increased the amount of spending. So if you take what we have done to inject money into the economy through stimulus and the deficit, and you pile those on top of the debt, we could very easily be seeing a debt that could approach 27, 28, maybe $30 trillion. Now, interestingly, that has not even been a part of the political discussion. It wasn't in 2016, and I don't see either candidate raising it this time. But it is a profound factor. The only thing that is allowing us to continue to do the kind of spending that we're doing has been the fact that the United States of America has the best credit rating in the world among global currencies. Should that ever begin to change, and if they're no longer able to sell debt, or if we begin to see hyperinflation as a result of various, our health situation could change dramatically in terms of the way we deal with it. And I would suggest to you we're in a bit of a race right now as to whether or not we can make value-based care work soon enough to be part of the solution to that conundrum. If we can't, and those economic forces require that there's a solution, we really only have two other options, neither of which are particularly good. One is to simply provide less care. The other is to begin to ration care in ways that would, in various ways. One of those ways that they could begin to use is to say, we're going to simply require payment to be at lower and lower rates. So hospital systems would be told by the government with government price setting how much they could charge. Well, that's a formula for quality beginning to diminish. It could also energize a bit of innovation, but we have in front of us a quite bold challenge. And the thing we're talking about today, which is public health, is going to play a big part in that, because ultimately, if we're going to fix the economic equation, we have to get people healthier. And the very most efficient way to get everyone more healthy isn't by paying hospitals more, it's about having the public health be stronger.
And one of the pieces here that you've been an advocate of and talked consistently about the importance of value-based healthcare and this shift. It hasn't gone fast. It hasn't gone with great dispatch and speed. What needs to happen in order for it to become sufficiently strong enough in terms of the economics that people begin to recognize that that is a solution?
I have always believed that the transition from where we are today, something comfortable that people understand and have learned how to manage, to value-based care was an extraordinarily hard thing. Hard enough that we would never do it unless we absolutely had to. And the only reason we would have to would be the economic dispassionate forces of a global marketplace saying to our country, you've got to get your health care costs down, or you're no longer going to be competitive. Either you fix this or you're going to lose your place as the leader economically in the world. Now, if that begins to happen, then we face an ultimatum that we have to do these things. And to a degree we're feeling that, but not to a deep enough degree that people have been willing to make the changes required. I believe we're headed to a time when that's going to happen. I think we're going to feel more and more economic requirement. And COVID will be a big part of that, not just because it has provoked all of this spending, but it's also clear that the institutions who have been doing it well have been prospering during this period, and those that haven't have been hurt by it. And I think that there's a market force that's going to say those that have been successful at moving to value are doing better than those that don't. That's going to be another force that drives it.
So we started this discussion with public health as a secret ingredient in the value-based healthcare equation. So let's conclude with that concept. How so?
Well, we talked at length today about the fact that, first of all, we've got economic challenges that we have to face. And that the reality is, to do that, we have to keep people healthy rather than just care for them after they're sick. And that the most efficient way for us to do that is to make certain that the air is clean, that the water is clean, and that we're practicing things that will ultimately keep people healthy. Because when everyone is healthier, the overall cost is in fact lower. So the reality is, public health is the invisible ingredient that will make value-based care work. And we've neglected it too long. We've neglected it over the last 40 years, but the next 40 years needs to be the era that public health steps forward. It's Public Health Day.
Well, Governor Leavitt, thank you so much for being with us. You've been an important commentator in value-based healthcare on the social determinants, and your perspective on public health is truly appreciated.
Thank you, Rich.
We're grateful for your being with us today. Our next session will focus on an international global issue. Dr. Nick Hicks from the Green Templeton College at the University of Oxford will join us and talk about the sustainability of their national healthcare system. We also want to remind you of our upcoming spring symposium, which we'll hold in some fashion between May 11th and May 13th. And again, we thank our sponsors and co-hosts. Our co-hosts were the Eccles School of Business and the Green Templeton College at the University of Oxford. Thank you so much.